Both. Welcome everybody to our presentation today on understanding disability classifications and special education eligibility. Before we get started with the presentation, we have joining us our interim acting superintendent, Dr. D'Antona, and he just wanted to share a few words.
Yeah, thanks so much, Nathan, and good morning to all of you that are here joining us today. First, let me just thank Nathan for organizing the session that you guys are going to experience today, as well as the past and future sessions that will be coming. These sessions are an outgrowth of feedback that we receive from our community, and it's important for us to make sure that all things related to special education, that we're making access to information available to you, as we know that sometimes things very well may be unclear, or you're unsure about certain components in regards to the special education process. So we want to make sure you're as informed as we possibly can make you. I also thank Melissa Monaco, who is joining us as well, our District 25 Supervisor of Psychologists. So thank you so much, Melissa, for being here. As you know, we're hoping that this creates an opportunity for you guys to ask questions, and more importantly, continue to suggest other ways that we can help you understand the special education process to support your children, which is really why we are doing this. So Nathan, I'm going to turn it back over to you, and folks, thank you for being here, and please ask those questions.
Thank you, Dr. D'Antona. Again, welcome everyone. Feel free to put questions in the chat throughout the presentation, and or hold them till the end, and we will answer. We'll have a few minutes to answer questions at the end as well. So today's presentation is about understanding disability classifications and special education eligibility. This is the second in our series of family workshops being presented by District 25. Prior to this, we did speak about the Individualized Education Program, the IEP, and the different components of that. And today we'll be taking a little bit of a deeper dive into classifications and eligibility. My name is Nathan Yakubov. I'm the Administrator of Special Education for District 25. And I am here to support all of our students and families, parents, schools with any questions or issues regarding evaluations, services, assistive technology, or placement, really any types of special education issues that may arise. My contact information is on the screen as well. And we are joined by our supervisor school psychologist, so I'll let her introduce herself as well.
Hi, everyone. My name is Melissa Monaco, and I'm the Supervisor of Psychologists for District 25. I'm very excited to be here with you all this morning, and can't wait to get into it with Nathan.
Thanks, Melissa. Okay, so we, like I said, we're continuing to talk about the Individualized Education Program, the IEP. And just to review, as we spoke in the past, the IEP is really the guiding document for any student that is receiving special education services. All students who require special education services have an IEP, and the IEP contains information about your child's interests, their strengths, their needs, their goals, and of course the educational program. It is a legal document, and it describes how the Department of Education will provide your child with a free and appropriate education, public education, in the least restrictive environment. So that means that we want to provide an appropriate educational program for your student in a way that is as close to typically developing students as possible for your student. So like I said, last time we spoke about the different components of the IEP. Today, we're going to specifically be talking about one portion on the IEP, which is the classification. So before we get into the classification, we start with really answering the question of who is eligible for special education services and who is eligible for an IEP. The disability classification is determined by the Committee for Special Education, known as the CSE. In New York City, that's usually referred to as the IEP team. And the IEP team is made up of the parent, the school psychologist, a general education teacher, and a special education teacher. A student's disability classification will be determined through the evaluation process. So as you can see on the slide, it is the IEP team that determines whether or not the student is eligible for special education. And in order to be eligible, they need to meet the criteria of one or more of the disability classifications, which we'll be talking about throughout this presentation. In addition to meeting one of the disability classifications, they also need to have a need to require a special education program or related services by reason of that disability. So they have to both have a disability as a classification and also need services to support them with that disability. On the other side of the screen, you'll see where a student is not eligible it's either because they don't meet one of the criteria for disability classifications, or they do meet the criteria, but they are making progress anticipated based on their individual strengths and abilities, or the determining factor of them not meeting standards is one of the following reasons. Either there's a lack of appropriate instruction, a lack of in reading, or a phonemic awareness, vocabulary, reading comprehension, as well as a lack of appropriate instruction in math, or there's limited English proficiency in the student. So in any of those cases where it's really the program that is provided to all students is not appropriate, is not meeting the standards that we want for all our students, that does not mean that the student needs special education. That means we need to provide a better program for that student. But in cases where we are providing an appropriate program for all our students, and this student has a disability, and this student needs support to address that disability, then they would be eligible for special education. I wanted to take a minute and just speak about the 3K and pre-K process for being eligible for special education. It's slightly different than our school age students. So I don't know if we have parents on today that have students in 3K and pre-K, but this will be relevant to them. If your child ultimately is found eligible at the pre-K level, they will receive a classification on their IEP as preschool student with a disability. Although your child may have autism, they may have a hearing impairment or a speech impairment, that would not be listed on their IEP at that age. At that age, we would classify all of our students as a preschool student with a disability. Now, in order to be eligible at the preschool level, a student has to have a significant delay when compared with other developmental milestones in one or more of the following areas that you see on the slide. Either they need to have a significant delay in cognitive, that means their thinking and learning abilities, their language and communication, understanding, using language, their adaptive skills, such as toileting, eating, dressing, their social emotional development, so behaviors such as getting along with others and expressing feelings, or their motor development, physical development, including vision delays, hearing delays, or mobility delays. Or they meet one of the criteria described in this section as autism, deafness, deaf blindness, hearing impairment, orthopedic impairment, other health impairment, traumatic brain injury, or visual impairment. So either the student has a delay in one of the 5 areas that were listed: cognitive, language, adaptive, social, emotional, or motor, or they actually have one of the disabilities listed, such as autism or visual impairment, or the other ones that are listed there. In or both of those cases, the student also needs to have the special education services and programs approved based on their level of development. So it's not enough that they have a significant delay in one of those areas, but they also are approved to receive those services, and that would be listed on their IEP which services they are approved for. Now, when we talk about significant delay for a 3K pre-K student, generally we're talking about a percentage of a delay, which is usually 33% or more. That's based on testing that's done for the students. It usually translates into about a year behind. So if the student is tested and they come out on that level of a delay and they meet the other criteria on this slide, they will be eligible to be classified as a preschool student with a disability and receive special education services. Just a note of caution over here. A student who meets the criteria for one or more of the disability classifications doesn't necessarily require a special education program or related service by reason of that disability. So kind of to explain this, we have an example here of a student has other health impairments, so they have some kind of health issues, but they're receiving medication that allows them to participate fully in the general education program. If that's the case, we would not recommend special education services for them. They would not be eligible, even though they have a disability. Because remember, when we're recommending the special education program, it's for those students who have a disability and they require the special education supports in order to have access to their learning, to the curriculum, to the activities in school. What happened?
I'm sorry, we can't hear the Mandarin interpreters on that line. So you could just adjust your audio.
It is something wrong with the technical problem. I keep translation through my cell phone, but they don't hear me. It's very weird. You guys can see.
Just muted.
Ricky， 你要撳星6號喺個電話度，因為佢而家鎖咗嗰個聲音嘅。你撳星6號你就解。OK。
你接先吓 ，OK。
Okay, thank you. Sorry for that. Just some technical difficulties. Okay, so we will move along. So now we can get into the disability classifications. Again, as mentioned, the IEP team identifies the category of disability, of classification that most affects the student's educational performance. So when we're looking at this list, we have 13 classifications. And we're not going to read through it because we're going to go through every one now in the rest of the slides. But what I wanted to point out is that sometimes a student might fall in one or more classification, depending on their needs. The team, together with the parent, that includes the parent, will decide which one most affects the student's educational performance, and they will choose one of the classifications. It's important to understand that because sometimes we may question why we chose one over the other. So it's really about what mostly affects the student at that point in their development. So we're going to switch over to Melissa, and she will start to discuss the different classifications.
Thank you, Nathan. So as Nathan said, when we're going through the evaluation process and we've gathered all our data, and by data, I mean, any evaluations we found necessary, especially during that referral process. So if a parent put in a referral, for example, saying that, they felt their son or daughter required an evaluation to determine speech needs, feeding needs, we would already be having these evaluations to review. So out of the 13 categories of classification, the first one that we're going to discuss is autism. And this is one we're hearing about very often. And it's a disability that's characterized as a developmental disability significantly affecting verbal and nonverbal communication and social interactions that adversely affects educational performance and is generally evident before the age of 3. Now, with autism as a classification on an IEP, something I want to always mention is that some students at this age might not have ever received a classification through a medical diagnosis, and that's okay because the autism classification that would be actually given on an IEP is an educational classification. So we would determine if a student is eligible to be classified as autism through observations, through the evaluations, through rating scales. And then we would determine if this classification is the one that truly fits the needs of the student at that time. So other characteristics that are included in this is the engagement in repetitive activities and stereotype movements and resistance to environmental changes or changes in daily routine. So sometimes we see our students that, something changed during their scheduled time during the school day, and this is something that truly upsets them or sets them off. And, as part of that process, what we like to do is make sure that their routines are specific and they understand that changes are coming in that school day to better be able to support them. And one of the last characteristics is unusual responses to sensory experiences. And this could be different from every student on the spectrum. We have some students that, you know, sometimes they get their hands wet and this is something that truly upsets them. Sometimes they might hear an alarm if we're doing like a fire drill in the school and the sound of an alarm really sets them off. Or even something as simple as, you know, the clothing they come into. Sometimes we don't think about that. But sometimes students are very, very sensitive to textures in their clothing. So sometimes we see students that don't like having their tags still on their clothing because it bothers them, and it truly disrupts how they're able to focus in class. We also have some students that don't do well with wearing jeans, and sometimes we have to, you know, be able to accommodate and discuss with families if we could try and see if maybe wearing a different type of texture of pants, like cotton pants, might be more helpful for that student.
Sorry, Melissa, real quick. The Chinese interpretation is not happening again. Just want to flag it for our interpreters. I see Ricky in the chat asking to let him in, but there's no one waiting to be let into the meeting. Is the other interpreter available to help out?
Yes, I'm doing the interpretation right now. I'm
Okay, so
unmuted
we're not.
myself. Am I audible on the line?
Can you talk again?
Yes. Testing 1, 2, 3.
Jenny, do you hear him? I don't hear you I'm joined on my phone. I don't hear it.
I'm on the line right now. It is a regular line, and then we input the ID number. I can put here over here Ricky on the line. Is there a separate Teams line that you open?
Yeah, it's the one that we shared. The ID number ending in 358.
The ID number is 358, and we are both in the line right now. I can hear
what does
him.
your phone number? What does your phone number?
347-988-0189.
0189. I see you on there. I don't hear you though at all on my phone. Jenny, can you hear them?
I cannot unmute.
Oh, you just did.
So I cannot hear. See him in the room.
Oh, okay. So I think the default setting, the default.
All right.
Thank you.
Go for it. Yep, you're good.
Thank you, Louis. All right. So our next classification we're going to discuss is deaf blindness. Now, deaf blindness is one of our classifications that when we are actually going to classify a student with deaf blindness, we actually need medical documentation. And the medical documentation that we usually review during the IEP meeting is an audiogram or an ophthalmological report. So it's actually required for this classification. We can't move forward. Now, to get into what deaf blindness is, it's a combination of two things. The student needs to have show significant severe needs in the areas of hearing and visual impairments. And these needs cannot be accommodated in a special education program solely for only deaf students or students that are visually impaired or blind. It has to be a very specific special program for them to be able to support those needs. Our next one is in a way similar, that we need medical documentation to make this classification. And the documentation that's often reviewed is an audiogram, and it's usually reviewed by, our staff that include audiologists as well as teachers of hearing. And what deafness is defined as is a hearing impairment so severe that it impairs the processing of linguistics information through hearing with or without amplification and adversely affects educational performance. Along with deafness, most of the times on top of just having accommodations, which could include FM device or other types of devices that are determined appropriate for the students. We also have hearing services that are provided for most students to help them be able to, one, understand their devices that they're using on a day-to-day to help enhance their learning, as well as understanding how to advocate for themselves. So some of our students, have either their hearing aids that we're teaching them how to be able to let the teacher know when they run out of batteries or they're hearing too loud and it needs to be adjusted. This usually happens during the beginning stages when a child is small, because we want them to be able to advocate for themselves. Okay, so our next classification is one that is called emotional disturbance. And this is one that we like to talk very in depth because like all of our classifications, we often have students that at some point might go through moments that they have emotional needs. And that doesn't necessarily mean that they would be classified under emotional disturbances, because what this classification really discusses is specific categories that are exhibited over a long period of time to a degree that it adversely affects the educational performances. Some of the characteristics are the inability to learn that cannot be explained by intellectual, sensory, or health factors, an inability to build or maintain satisfactory interpersonal relationships with peers and teachers, inappropriate types of behaviors or feelings under normal circumstances, a generally pervasive mood or unhappiness or depression, and a tendency to develop physical symptoms of fear associated with personal or school problems. Now, something I want to add, just because a student does have a classification of emotional disturbances doesn't always mean they require a specialized programs, but those programs are available if a student's needs require them. A student with emotional disturbances can often be in a community school setting with support. However, if the degree of need is very high and is being exhibited and it is affecting the educational performances, there are other programs that could be considered for the student. Okay. Now, I really like this slide because it is giving us a warning on the difference between an emotional disturbance, a true emotional disturbance, and a social, what we consider a social maladjustment, right? So they're not the same. So a social maladjustment can negatively affect educational performances, and they could be described as a dysfunctional family background, the tendency to respond more quickly to negative sanctions than to positive reward or gang involvements and truancy. So sometimes we do have students that come from backgrounds of families that have some dysfunction, and that is what is setting a student off, why the student is going through an emotional moment, but in that moment, that is not considered an emotional disturbance. We also see students that display irritability or anger, which are used manipulatively to control people and situations. Unusually high self-esteem, but fragile. If distress occurs, it's situational and usually related to being held accountable or experience a loss of power and control. This is also considered a social maladjustment and not an emotional disturbance. Refusal to take personal responsibilities and tendencies to project blame onto others or events. The student sees him, herself as faultless or having reacted justifiably to perceived transgression against him or her, and values and morality that are determined by the situation and by whatever the student wants at the moment. Another one that's really big is substance abuse and alcohol abuse. Although we see some students with emotional disturbances abuse substances or alcohol, that doesn't mean that every student with a social adjustment does have an emotional disturbance. Sometimes as we get into middle school and high school, we do see some students in some way trying to experiment with these, and I think the support would be warranted more for the social adjustment and not necessarily because it's an emotional disturbance. A lack of empathy or remorse may be described as having no conscience, and close thinking patterns, that is, a student is not interested in others' opinions or judgments in areas such as responsible living. She is not able to he or she is not able to view himself or herself in any critical way. The student is not responsive to suggestions, to changes, and tends not to learn the experience, mistakes, and consequences. So when we're going through the evaluation process, we're doing a lot of different observation rating skills. We're gaining a lot of information from um, whoever is supporting the students. This could be an outside therapist, family members, school teams, to determine the difference between an actual social maladjustment and if it's an actual true emotional disturbance. And we'll be able to make that determination as a team. And as Nathan said, an IEP team is consisted of teachers, special education, general education teachers. Parents are a part of this IEP team. And when students get older, also the student as part of this team to make that determination and review those evaluations. Okay, so another of our one of our 13 classifications that also requires medical documentation to make this classification is hearing impairment. The hearing impairment could be a mixture of both, could be permanent or fluctuating, that adversely affects an educational performance, but is not included under the definition of deafness. Okay. One that we often hear a lot, especially when we're, going through the process, is we're discussing learning disability. And we often see this a lot, whether, we're speaking to friends, whether we're just looking up initial information about IEPs, we're looking at a disorder in one or more of the basic psychological processes involved in understanding or in using language or spoken or written that manifests itself in an imperfect ability to listen, think, speak, read, write, spell, or do mathematical calculations. The term includes such conditions as perceptual disability, brain injury, minimal brain dysfunction, dyslexia, and developmental aphasia. Something I want to add with determining if learning disability is the correct classification is, once again, we're reviewing data, right? So a part of that data, when a student is going through the evaluation process, but before even the evaluation process begins, our students should be receiving interventions prior to the evaluation, which is telling us that, we've specifically provided interventions in the specific areas that we see that the student has been having difficulty, whether that's math, whether that's writing, whether that's reading. And it's been going on for quite a significant time. Usually we're reviewing this data every 6 weeks to see how the interventions are going, how they're supporting the student. If we see that, oh, we've provided intervention for the student, and guess what? The student has, gone up a few reading levels, is, understanding the concepts of math that are being taught to him or her, then that's telling us our interventions are working and we need to support the student more with these interventions. Or they might tell us, okay, we've exhausted, the level of support with interventions, and we might want to take a closer look and go through the evaluation process and do our testing to determine what areas, the student is still having difficulty in, and what ways we could actually support them still. Okay. So in this slide, we're talking about the IEP team may determine that a student has a learning disability. And as I said, when provided with learning experiences and instruction appropriate for the student's age or state approved grade level standards, the student does not achieve in one or more of the following areas. So on the left side, we talk about the oral expression that we might want to target the listening comprehension, the written expression, the basic reading skills, the reading fluency skills, reading comprehension, mathematics calculation, and mathematics problem solving. The student does not make sufficient progress to meet age or state approved grade level standards in one or more of the above listed areas when considering the student's response to scientific research based on intervention. So this is where we discuss that the interventions are provided to the student, and when we're reviewing the data, as all our school teams should be doing, we're determining if the research-based interventions work for the student or if not. The student exhibits a pattern of strengths and weaknesses in performance achievements or both relative to age, state approved grade level standards, or intellectual development that is determined by the IEP team to be relevant to the identification of a learning disability using appropriate assessments. Okay. So this classification is called intellectual disability. And this is a classification that is usually, it takes time to determine this. And for some students, maybe off the first evaluations, we can make that determination. Now, this is a significant general intellectual functioning. So what we're discussing is we're discussing a student that we're reviewing an evaluation, and that evaluation could be a psychoeducational, which is measuring cognitive skills, which is measuring academic skills. We're also including adaptive measures. Now, I know Nathan discussed adaptive measures briefly, but what adaptive measures are is how that student is able to function in terms of being able to take care of themselves, brushing their teeth, getting themselves ready, being able to feed themselves, being able to advocate for themselves. That's a portion of that psychoeducational evaluation. Also getting information about the academics, how the student has progressed, in what areas has a student progressed, provided with all the supports already provided to the student. So an intellectual disability, sometimes we do see students, we should be seeing students with difficulty in the cognitive areas, low adaptive skills, and this percentage of students is very, very low in the sense of this classification shouldn't be something that's given unless truly necessary, because we're really just talking about our students with severe disabilities and would require a program to really be able to support them in their life skills as they grow up. Okay. Multiple disabilities is actually a disability that is characterized by the impairment of a few areas. It cannot be accommodated in a special education program solely designed to address one of the impairments. And one big thing is that multiple disabilities does not include deaf blindness. So sometimes we see students that already have the classification of deaf blindness, and we say, okay, well, they carry two classifications, so this must mean that multiple disabilities is the correct classification. But the classification of this includes a few things. So it could include an intellectual disability, as well as something else like an orthopedic impairment, an emotional disturbance, and usually to accommodate reviewing the data, we also include medical evaluations from an orthopedic assessment, other adaptive behavior skills to be able to move forward and make this classification as an IEP team. Okay, and now we're getting into what orthopedic impairment is, which is characterized by a severe physical impairment that adversely affects a student's educational performance. This could be, this could include a congenital anomaly, such as a cleft foot, an absence of, a member, so meaning some students that, do not have a limb. Impairment caused by disease. So sometimes we do see students that do have some medical diseases such as bone tuberculosis that are included under this classification, and other impairments that might fall under orthopedic impairment could be cerebral palsy, neuromuscular disorder, amputation, and a fracture or burns, which cause the need. So as well as some of our other classifications, we do need a medical evaluation to make this classification as well. Okay. Another classification we're going to discuss is other health impairment. Now, this is characterized by the impaired strength and vitality of alertness that results in limited alertness with the respect to the educational environment. The impairment must be due to chronic or acute health problems, including but not limited to a heart condition, tuberculosis, rheumatic fever, nephritis, asthma, sickle cell anemia, hemophilia, epilepsy, lead poisoning, leukemia, diabetes, attention deficit disorder, attention deficit hyperactivity disorder, or Tourette syndrome. The impairment must adversely affect an educational performance. So oftentimes we do have parents that want us to review medical data because they do have some type of medical diagnosis. But something we always try and make sure we stress and review is that the impairment that the student has a diagnosis for must affect the educational performance. Because if not, then it could be supported in other ways through the classroom, through a 504 plan. Okay, now, speech and language impairment is a communication disorder. So for this classification, what we usually do is on top of reviewing most of our evaluations, like a psychoeducational, social history, and a classroom observation, a part of this classification, we must include a speech and language evaluation, which a speech therapist is conducting the evaluation to determine different areas of speech that are impeding in educational performance with the expressive and receptive language. A student might have difficulties with stuttering, and that doesn't always mean that every student that has a stutter would be found eligible for speech and language services. Some students have impaired articulation, but it must really affect the educational performance. Okay. Traumatic brain injury is characterized by an acquired injury to the brain caused by external physical force or by certain medical conditions such as a stroke, encephalitis, aneurysm, anoxia, and brain tumors. And this results in the impairment that is affecting the educational process. Again, to make this determination, we must also have medical documentation, such as a neurological, to make this classification. So some more information regarding a traumatic brain injury. It must include either open or closed head injuries or brain injuries from certain medical conditions, resulting in mild, moderate, or severe impairments in one or more areas, including cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, psychosocial behavior, physical functions, information processing, speech and sensory, perceptual, and motor abilities. It does not include injuries that are congenital or caused by birth trauma. Okay. And now we're going to discuss visual impairment. So once again, to determine if a student is actually able to be found eligible under this classification, medical documentation is needed. So this would include a report from an ophthalmologist, to determine the needs and the severity, and also information from our teachers to determine how it's impacting academics. So visual impairment is an impairment to vision that even when correctly adversely affects the educational process. And the terms include both partial sight and blindness. As a part of this classification, if a student is found eligible under this classification, usually we have students that receive not only accommodations within their environment, so large print, braille. We also have students that do qualify to get vision services from a vision teacher on their IEP as well.
Okay, thank you so much, Melissa. I mean, that was all 13. That was a lot of information. And I hope everybody was able to get some more insight into the classifications and the process that the teams use to determine whether or not your student will be eligible for services and what services to provide and how to best describe that. We'll open it up to questions now from Melissa and myself. If anybody has any questions, you could either put it in the chat or just, can they unmute? Or I guess you can, if you can unmute, you
Yep,
can.
I'm gonna let everyone give everyone the option to unmute themselves.
Okay, if anybody wants to unmute and ask a question, go ahead.
Mhm.
Oh, so Melissa, we have one question from Sandy. Where does ADHD fall? That's a very good question.
So we have a student that has a medical diagnosis of ADHD. They will fall under other health impairments, but also taking into account that the ADHD has to be impacting an education. So some students do have ADHD and they can be supported in a school setting with accommodations under a 504 plan. If we find that a student does have ADHD and requires the support of through an IEP, it would be under other health impairment.
Thank you. Thank you, Sandy. Any other questions?
And also the interpreters, if there's any questions in your rooms, you can go ahead and bring them forward as well. Thank you.
Good morning. My name is Emily Lee. Thank you so much for all the information given. I have a question. I have my son with IEP in the Horizon program. What will happen if all his needs hasn't been met? Like, for example, he is in an 8th grade right now. He's graduating this year, and he's still in a 4th grade level. What other services or what kind of help? I did mention to the school, is there any reading program or any other help that he can get? But unfortunately, not all schools follows the same guidelines like I hear from you guys today. So is there anything else that can be done? I mean, he has been through so many issues in the school that he got to the point that the teacher caused him anxiety. He didn't want to go to school. He was so sad. He used to cry. And of course, I did go to the District 25. I did bring that issue to them. And I don't know what else to say. That's what I would like to know. What else can I do? Or should I consult the school again? Or just let him finish 8th grade and see what's happened next for high school. Next year, he's going to high school. High school is a big different story.
Thanks. Thank you for the question. Definitely, we always encourage parents to collaborate and work collaboratively with the schools. And obviously, we can't go too much into this situation because it's a more personal situation. And definitely, you can follow up with either Melissa or myself afterwards. One-on-one if we need to really go into the program and the recommendations. But I would just say that definitely special education services can continue throughout high school. We do have a lot of supports available at that level as well for those students who continue to need that support. So your school team should definitely be working on that this year as they develop an IEP for the transition for next year if the student continues to need that. And then, like I said, just continue to work with the team at the school to determine what's working and what can be modified perhaps for them to work. Remember, when we talk about an IEP, we're really trying to meet the student at their level and support them to the best of their ability so that they can have access to the learning, to the curriculum. And that's going to look different for every student. Because I know that you mentioned the grade level that he's on. It's really a matter of progress of whether they're able to, access the learning and make some progress along there, because that's going to look different for every student. But again, we can talk more, one-on-one if we want to discuss that a little bit more. Melissa, do you want to add anything?
Sure. Thank you so much. And I left my number in the chat and my name.
Okay,
Thank
great.
you.
Thank you.
No, Nathan, I think you did a great job on that one.
Okay, thanks.
I
And then we
see
can-
a
question,
question in the chat that's saying, can evaluations by DOE school psychologists be used to obtain OBWD services? Now, feel like there's two responses today. I have evaluated students and provided parents with psychoeducational and updated social history, and sometimes OPWD will accept these evaluations. I have had other instances that the parents have requested this testing through the school, or the student had a mandated triennial that year and was getting evaluated, and OPWD did not accept the evaluations because they felt like their evaluations needed more information. The type of evaluation that was needed was more of a medical model, and our evaluations are based more out of an educational determination. So we're looking at more academics, while OPWD is trying to determine medical needs to be able to provide those services needed.
Thanks, Melissa.
So it depends.
We have another question about requesting an ADHD test. I guess, how would we determine if they have ADHD and if they would qualify for services?
So back to the medical model, most students that do come into school already come with a medical diagnosis of ADHD because a parent has discussed it with their pediatrician, and the pediatrician has sent them to a developmental specialist. Now, through an evaluation process, we could do rating scales to determine what characteristics a student is demonstrating that are impeding in the academics, which could include the ability, the difficulty in sustained attention, and things like that. So we could collect data that could help that medical diagnosis as well, and that data could also be provided to a specialist. But this is a medical diagnosis.
Thanks, Melissa. The next question from Angelina is, my daughter, fourth grader, she used to have an IEP, but she still struggles with pronunciation. Even her pediatrician has noticed it, but the speech therapist sees no problem. How can she get an evaluation? So, Angelina, just talking again about any of our disability classifications or any delays that we may see in our students or our children. When we're talking about school-based services, we're really going to look at how that's affecting their educational performance. Like Melissa did mention, when we were talking about speech and language impairment, there are times, for example, where a student might have articulation issues, which might be in this case, or even a child that's stuttering, but we have to look at the overall determination about how it's affecting their actual learning. So it could, again, I don't know the specifics of your daughter's case, and if you want to have her reevaluated, you would reach out to the team, the school at the team at the school, put your request in writing and give it to the school, and they can address that. But just keep in mind also that, there are times where students, just like we went through all the slides, they may have characteristics of a disability, but they may not qualify for services based on the need and whether or not that's affecting them with their educational performance. Okay, any other questions? You're welcome. Okay, I think we had a lot of good questions actually after this session. So thank you all for your participation and your active participation. And do we have one more question here?
Yes, I'm sorry. Can you hear me?
Yes.
I'm sorry. I don't know how to type on the thing on the Zoom here. My son is in third grade. He's actually currently in a community special ed school. He's on the spectrum, but he's kind of in between, he's average to below average. And I had them re-evaluated, and they say, oh, you should stay in the community school special ed program. The problem is all the community school special ed are 2 grades together, meaning kindergarten, 1st grade, that's one class, 2nd to 3rd grade class. He's 3rd grade. He's in the special ed. He's behind in reading, but advanced in math. But they're still repeating the same 2nd grade lessons to him, which is very difficult in a special ed class that's 2 grades together. And he's going to take the standardized test. I want him to take the standardized test. How do you go about? I'm not even sure. What do you do? I spoke to the principal, like, oh, they know how to teach 2 different grades, but they're not really. They're just teaching the lower grade stuff to 3rd graders in the class.
So thanks, Amy. It's a good question. Unfortunately, we do have some schools that need to bridge classes together, grades together. 2 grades where they're working on that just based on the amount of students that are there. Obviously we want children to learn with other children as well, so we want to make sure that there's an actual class for them with other students. But at the same time, they are required to address all the students' individual needs. That's why they have an IEP, which shows their individual needs, as well as the grade level curriculum. So the principal is right to a certain extent that the teachers are addressing both of those. Another thing that the school might want to explore is we do have students that have a more flexible schedule, where if they are excelling in one area, they might be going to another class for that specific area. And that's definitely something you can discuss again with the school to see if that might be appropriate for your child. But if not, then they should definitely be, addressing his needs in the classroom, and they do that by working with the students in small groups, with different adults in the room with the teacher, as well as modifying the lessons for those students. Again, if it's more specific after you speak with the school, if you feel that you still need support with that, definitely reach out to one of us individually. We can delve a little bit deeper into that.
Okay, and just a follow-up, sorry about it, one more
Yeah,
follow-up
that's okay.
question, because this current school he's at is only goes up to 3rd grade, so he's gonna go to another local zone community school after this for 4th and 5th grade. And it seemed like what I'm hearing is all the special ed in the district are basically 2 grades together. Like these the 10 to 12 people classes are 2 grades together. Is that correct?
No, that's not accurate. Like I said, we do have some schools where, based on the number of students, the classes might be bridged. And the only reason we would encourage it is because there might be a lack of students, and we don't feel that it might be appropriate for, only 2 students to sit in a classroom all day, because that will obviously affect their social development as well, and the way that children learn. So we want to maximize, the resources that we have, but we definitely do have schools that have a grade level of class, just for, let's say, 4th grade special education as well. We can help you with that. If you have questions about that, you can always reach out to the district office, and we can kind of guide you with those kind of questions.
Okay, where's the information on to reach out to someone in the district office?
Louis, can we put the number in the chat?
Sure.
Thanks.
And you can actually, if you want to go back to your first slide with your information, but I'll put the main contact information for the district in the chat as well.
Perfect, thanks. And
Okay.
then we
That's
have, I
Nathan's
think,
info.
we have one more in the chat. Thank you for answering my questions. A follow-up: where can families find resources for finding healthcare providers and/or facilities for purposes of evaluations for IEP classifications? I am a parent of 3 IEP students, and it's very hard to find these providers, especially considering insurance. So I'm just trying to clarify, Maria. They already have an IEP, so you have had them evaluated? So Maria, I'm not exactly sure what kind of evaluations for outside resources. They already have an IEP. Okay, so maybe you're looking for some additional supports. You could definitely start by speaking with your school social worker and your school psychologist to see if there's any resources they can share. We also have at the district, we have a district social worker who can assist you with that as well. We can put her information in the chat as well if you wanted to reach out to her for support with that. Louis, do you mind if you could put Wing's information in the chat? I'm not sure if she's on.
Sure. Yep,
Thank
I will.
And Angelina Huda asked, so my daughter gets reevaluated again. Just reach out to the school. You can give it to the assistant principal or the principal, just at the main office. Let them know, put it in a letter, and just let them know that you want to share with them because you want your child reevaluated, and then they'll address that. Okay, again, very interactive session. So thank you all for participating and asking very good questions. You have our information. This presentation will be uploaded as well to our district site, so you can review it again. And Lewis is putting the information in for the contacts as well. And yeah, Maria, we got you. Definitely, Wing, our social worker, our district social worker, would be able to help you with some outside resources as well. And we'll put that information in there. Okay, thank you, everybody. We'll stay on for a couple more minutes if anybody has any questions, but otherwise, you're free to go.
Yeah, and I thank all of you guys for joining. If for whatever reason you were uncomfortable in asking a question, either in the chat or out loud, please use the information that was shared in the chat to reach out to our team. We're always happy to connect with you guys to make sure you get whatever you need as a parent. So thank you guys for being here today.
Thank you, everyone.